Hello and welcome to Healthy Living. I'm Dr. Donald Pelto. I'm here today with Zachary Smith, and he is from a company called Patient Education Genius. And this is a company that helps with patient education. And we're going to talk a little bit about today how is patient education with patients, and then how is this company something that's able to help doctors. So Zachary, thank you for joining the show.
Thanks so much for having me, Dr. Pelto. Appreciate it.
Interested in this whole idea of patient education and teaching and helping, providing resources to patients.
Sure, yeah. Well, it's been a long road. My mom was a nurse, her mom was a nurse. But ultimately, there's sort of a single moment that led to Patient Education Genius. My dad was getting a stent put into his heart. Pretty standard procedure. And while he was under the knife, so to speak, some plaque was dislodged, and it actually caused a heart attack while he was having the procedure. He was fine. I'll fast forward. He's fine. He's still with us. But the cardiologist came out, and he found me in the waiting room, and he started trying to explain to me what happened. And here you have, the chief of cardiology at this hospital, and he's drawing this really funny picture on the back of some very important form. And I just thought to myself, man, there's got to be better ways for this guy to spend his time, a better way to illustrate to me, the concerned family member, what just happened. And also, how am I going to go and explain this to my dad when he comes to? This is, a bunch of chicken scratch on a piece of paper. And I've heard enough stories about similar situations that my partner and I, Tom, we decided, there's an opportunity here for a better way to educate patients, better for the providers providing the education and better for the patients receiving it.
Perfect. And in terms of patients now, for example, my patients and those that you've worked with, if the doctor isn't giving them any other information, they're probably having to go to other resources, aren't they, to get that patient education information? What are some of those resources?
Yeah, absolutely. Yeah, well, it's like a really common phrase you hear in healthcare today is Dr. Google. And I think that every person, I was going to say every patient, but really it's every person, because everyone has the experience of being a patient who's uncertain about some condition that they might or might not have. And the very first thing you do is you either go on WebMD or you search Dr. Google. And invariably, you determine that you have some sort of life-threatening disease with no cure. That's the most common experience. And so, that is, and then meanwhile, that's sort of patients at home by themselves. And then meanwhile, within the actual healthcare setting, hospital, a private practice, what have you, education is usually limited to printouts that have been photocopied many, many times and sort of have, a blurred edge around the whole frame, outdated, brochures that are sort of generic, and basically a hodgepodge of different ad hoc solutions that the providers had cobbled together over time.
And so I think patients, even if they go see a doctor, they may get some of these handouts, but if they're not too impressed with, like you said, the hodgepodge of information, they're going to go back to Dr. Google and to get some other information. And I think sometimes, don't you think that information that the patient is getting, it might not be the exact information the doctor wants to give them?
Right. No, exactly. I mean, I think that Dr. Google probably creates more callbacks. Callbacks is a term that is in healthcare refers to basically just what it sounds like, a patient calling their practice, calling their doctor and saying, can you clear this up for me? Or, following up with considered an inefficiency, because really this should have been clearly explained the first time around. And this is one of the reasons why you hear about doctors and nurses being pulled in so many different directions and so busy, because they have to deal with callbacks from patients not understanding their instructions, Dr. Google leading them astray because they don't have a clear understanding of their condition or how to take care of themselves.
I think now that we understand the situation of patient education amongst doctors and what's kind of not working, and then you kind of
Yeah.
tried to come up with some type of a solution, and in the solution, I think it's enveloped in this online resource called Patient Education Genius. How'd you come up with the
Yeah.
name, and tell me a little bit about what it is?
Yeah, sure, sure. So Patient Education Genius, it's a platform that enables healthcare providers to digitally deliver educational materials to their patients. It's launched from the electronic health record, which is electronic health record systems for your viewers are sort of like the operating systems of healthcare. And it's really important to integrate any tools that a doctor might use into these systems so that all of their work is documented. They don't need to go, look something up on another tab of their browser. It's just to make it easy for them. It's integrated into their record, into their system, excuse me. Um, and basically, what we sometimes call Patient Education Genius is Spotify for patient education. So we kind of took the idea from what we were just talking about. We took the idea of Dr. Google, and we took the idea of the information that your healthcare provider gives you, gives to the patient, and we tried to merge these ideas and kind of get rid of some of the inefficiency, because there really is a lot of enormously powerful health information publicly available out on the internet. So how do we harness the power of that information while also making sure that patients aren't getting sort of false positives and aren't getting confused and overburdened and so on and so forth? And so, like Spotify did for music, what we did was we aggregated, we didn't make any content ourselves, just like Spotify or iTunes don't make music. We aggregated all of the best content that's available online. And generally speaking, this content, this educational content for patients, is created by patient advocacy groups, professional medical associations, and government agencies like the CDC. And so we compiled it all into one platform so that it was really, really easy for physicians, for doctors and nurses to access, and enabled them to basically be able to text or email that education to the patients right there during the consultation. So sometimes we call ourselves the printer killer or the copier killer, because we're trying to eliminate that step in the patient education workflow and make it much easier for providers to get quality content to patients like that.
And then, so the doctors that use your platform, they can either use the content that you provide for them, or they can also upload their own content. What type of content can they add for themselves?
Yeah, yeah. Great question. Thanks for asking that. It immediately upon the first version, we've been at this for about 5 years now, and we've gotten so much great feedback from our provider users. And almost one of the very first things that we heard, um, you know, in the original version of our product, we actually licensed content. We paid for content rather than aggregating these amazing resources that are publicly available. And the very first thing that we heard when we gave our users this really excellent content was, can I edit this? And so immediately we knew, oh, there's something we missed here. And what we missed is that every healthcare provider has their own way of instructing patients. Every healthcare provider has their own way of communicating with their patients. And I think patients don't always understand that there's a lot of different styles to imparting information to patients. And so what we did was, long story short, is we created a tool where our users, doctors, nurses, etc., can upload PDFs, videos, web links, basically anything you could think of, almost like, to use another comparison, like Dropbox. They can upload whatever they like, and then they can send that information out to patients via text or via email as well. And ultimately, this customization just makes it, it solves more problems for the doctor and makes it easier for them to get all their information to patients.
So if those that are kind of just listening here to the program and they don't have a doctor that's using Patient Education Genius and they just want to go check it out, what website would they go to just to see what the content's like and take a look at it?
Yeah, sure. So it's patienteducationgenius.com, and even if you aren't a healthcare provider, you can use our search tool to find to just look up whatever information we have there. Again, we feel that you should always be consulting your healthcare provider. Information straight from the internet is only going to get you so far. While it's important to be empowered and engaged in your care, you really need to have an expert help walk you through this information. And so we'd encourage you to do that. However, please visit our website and explore all the content that's there. There's about 220 different sources of information with a combined total of over 40,000 patient-facing resources. It's a lot.
Yeah.
It's a lot.
And
it's a lot, and it's still growing.
And for those that are listening that may be a healthcare provider, if they're interested in learning or using it or adding on to their medical record or being part of it, what does it take? Can it be? Does it only doctors and nurses? Can it be chiropractors or other specialties? How does that work?
Yeah, sure. So we've really designed it to be used by any specialty and any size organization. We have health systems, like multi-hospital health systems, using Patient Education Genius. Yeah, I know that you use it in your own practice, and we have lots of smaller practices with just one provider who are using it as well. And the way that we're able to achieve this scale is we integrate into different electronic health record systems, as I was saying earlier. The four that we focus on are Athena Health, Epic, Cerner, and Allscripts. And really, it is a very, I'm going to get a little bit technical here, but we use a new standard for integration called Smart on Fire. Basically, if anyone has been following the healthcare news lately, they have probably heard that healthcare data interoperability is a big hurdle. And so there are a lot of initiatives to make it easier for data to move between hospitals so that a patient can move from hospital A to hospital B without any records being lost. And so we're taking advantage of some of these new standards for communication and data transfer to make a really easy integration. I mean, honestly, I think our Athena Health integration, we could have an office up and running in a day, 2 days. It really just depends how long it takes them to upload their content.
Yeah, and then it's interesting because when a provider, whoever that may be, uploads content, when they send it to the patient, it also automatically does a couple of other things. You might want to talk about. I think it documents it in the chart, and it has the patient portal, and it has some other things about online reviews. So tell us a little bit about, once I send the patient the content, what happens next?
Yeah. I mean, that's such a great question. And it makes me want to zoom out for a moment and just say, like, beyond my experience with my dad, beyond all these anecdotes we hear about, folks not understanding their medical instructions or their treatment instructions, I think it's important that your viewers understand that this is like a huge problem. About 1/3 of patients don't fill their prescriptions. There are billions of dollars in wasted spending in healthcare, effectively because patients don't totally understand how to follow their treatment instructions. It's a predicament of epic proportions, and so there's a lot of money being invested in finding solutions like Patient Education Genius that improve patient communication and improve something that's called patient engagement. And so the advising improved patient engagement, but to qualify for the government incentives, you need to document that you did educate your patients. And so Patient Education Genius, when integrated into your EHR, does that documentation automatically. So it's not an extra step. That's something that we're very proud of. So to answer your question though, upon pressing send, information is texted to the patient, and documentation about that education is written back to that patient's record so that there's always a record of what was sent to the patient. It's almost like right alongside a list of diagnoses and symptoms, there's a list of all the education that was prescribed to that patient. Now, when the patient receives the information, what we've done is we've tried to almost make it feel like a digital office visit. So, for example, when you and Dr. Pelto sends information to his patients, there's a photo of Dr. Pelto, there's your practice's logo, and some other really familiar elements that'll make the patient think, oh, okay, this is a message from my doctor. Their ears perk up, and they behave differently because, they trust you, basically. And that's what's missing from Dr. Google is trust.
We're going to show a screenshot here of what this looks like, and so people can look at it. And so once okay, that's the screenshot. Okay, so what else is on there?
Yeah. So basically, one thing that we found is healthcare providers, one of the reasons why they might not be spending as much time doing patient education is because their time is stretched so thin. And so our thought was, well, if we can make this patient education moment even more valuable to the hospital, if it's a hospital, to the business of the hospital, in addition to the outcomes, the health outcomes of the patient, then that will help to make patient education more of an organizational priority, if that makes sense. And so what does that mean? What that means is every single time a patient education genius user sends information to the patient gets the education in a text message or an email, but they also get, they're asked to sign up for your patient portal. They're asked to sign up for online bill pay. If our client has a type of cancer screening that they want their patients to come in for, like breast cancer screening, colorectal cancer screening, they will advertise. In effect, what I'm saying is that clinical services are advertised on these messages that go out to patients, because a patient might not know that their clinic offers free breast cancer screenings, for instance. And so basically this patient education moment becomes a moment when the healthcare organization can make patients more aware of additional services that they offer and make it more valuable. And so all of this is combined into this very, pretty little package that the patient gets.
Yeah. And one of my favorite features is, well, what happens if they ignore it? What's going to happen in a few hours or a few days later?
Yeah. So all those, basically what we've done, I should say that most companies in the patient education space, what they really focus on is building content. And again, we're Spotify for patient education. We don't build content. We don't write music and record songs. And so what we've done is we've really focused on engagement tools that really drive engagement with the education. One of these, as you're asking, is reminders. So if someone is prescribed education from their doctor and they don't open it within 48 hours, they're going to get a reminder message saying, hey, you really need to take a look at this. And we don't want to overburden the patients and annoy them with too many messages, but we do nudge them to make sure that they actually open the things that were assigned to them and absorb them.
I think that's very important. And also in this day and age, in terms of a private practice or any physician, I think that all patients, even if for being a specialist, if their primary care says to go see me, Dr. Pelto, the first thing that patients are going to do is they're going to Google my name. They're going to look for it. Yeah. And one thing that you're able to help me with is with getting these reviews, because reviews really matter, basically, because that's what people look at. I may be referred, but I want to look at a review. So how do you help doctors get more reviews online and things like that as well?
Yeah, absolutely. Thanks for asking. We were really excited to introduce this feature about a year and a half ago. every one of those messages that I just mentioned that have the education and you know, basically advertisements promoting clinical services also have one third feature, which is something we call the patient satisfaction chatbot. And so this is, if your viewers aren't familiar with the idea of a chatbot, you know, it's a small little window where a sort of pre-programmed conversation plays out between the patient and the patient education genius chatbot. And the goal of this chatbot is to solicit feedback from the patient. Did you have a good experience? Did you have a bad experience? And obviously, every healthcare provider in the world wants to know if their patients had a bad experience. And so if the patient reports to the chatbot, yeah, you know, Dr. Pelto, he spilled coffee all over me. I'm never going back. We would tell you, rather than saying, okay, why don't you tell everybody in the world about the coffee incident on Google? Instead, we say, thank you so much for your feedback. And we route that feedback back to you, our user. If the patient has a positive experience, then we send them to Health Grades, Google, Vitals. Basically, we send those patients out to leave positive reviews for their provider who did such a great job educating them. And what, you know, the theory behind this is, well, like you just said, folks with smaller practices, they need every advantage they can get to increase their online visibility. You know, you're a doctor, you're not an online marketer, so you need things that take these tasks off your plate and make your life easier. But even beyond that, our thought was, if we can tie the idea of educating patients to positive reviews, then maybe we can increase the amount of education that doctors are doing with their patients at sort of a macro scale. You know, if we can attach business benefits to the patient education moment, then it's easier for overworked, overburdened doctors to sort of prioritize patient education a little bit higher, because they're very efficiently addressing two needs at once: that online marketing need and the patient education need. And so we paired them together, and the idea is, you know, just like you want to get likes when you post a photo on Instagram, if you send education to your patient, you are that much more likely to get reviews online, which is good for your business and good for making other patients in the area aware of your services.
That's exciting. That's exciting. You know, we have about 5 minutes left. I'd like to do two things. First, I'd like you to explain, for those that are watching, once again, how they can kind of get involved. And then I'd also like you to kind of,
Sure.
if you could look 3 years into the future of Patient Education Genius, where do you see yourself in 3 years? Those two questions.
Wow, good questions. Good questions. Well, what we're trying to do is, again, the theme throughout our conversation here today is that providers are really stretched for time and resources.
Mm-hmm.
And so what we're trying to do is automate more and more of the functions that the providers don't need to be involved in. Now, we believe that providers always need to be picking the education,
Mm-hmm.
right? That's sort of where we started. No Dr. Google, no robo algorithm selecting the education for you. But if our platform can surface education relevant to this patient's diagnosis, it'll make that doctor's life that much faster when they're selecting the education, make their workflow that much faster.
And for those
so
that
we're
are
working
watching,
on things like this.
Yeah. So basically, for those that are watching, if you have a diagnosis of, for me, plantar fasciitis, it could narrow down and give you the one folder for plantar fasciitis and make it easier to select that information.
Yeah, that's a little abstract for viewers who haven't seen the interface, which is probably most of you. But yeah, really, in 3 years, what we hope to be doing is really automating a lot of the things that providers do. You know, our vision, or our sort of perspective, is that provider satisfaction equals patient satisfaction.
Mm-hmm.
The easier we can make providers' lives, the better we can make the patient experience. The patient experience sometimes suffers because at these big hospitals where they're pulled in many different directions, they don't have as much time with the patients. It's not that they don't want to spend time with the patients, it's that they just simply can't. And so if we can automate some of the kind of low-hanging fruit, the things that they don't need to be involved in, then they will, what we hope is that we can give time back to the patient-provider interaction so that they can spend more time building a relationship and a rapport rather than worrying about busy work. So that's the vision, is less busy work.
That's exciting. So just tell everyone as we're finishing up here, if they want to learn more, where they can get that and how to get their medical record to use you guys. How does that work?
Yeah, absolutely. So patienteducationgenius.com, and I'm Zach at Patient Education Genius. If you want to just write me directly, ZACH. And yeah, we would love to. Again, it's even if you're using a different EHR than the ones that I listed, we are actively exploring integrations into additional EHRs. And I should add that that there are other benefits that we haven't covered in this conversation, and the only one I'll touch on is that we see our patients opening that education I mentioned at about an 80% rate. Now that's super duper high. That's high for any industry of any kind of engagement, and we've worked hard to achieve that number, but it's also a testament to how much patients really do want to hear from their doctors, and we just facilitate that interaction. And so yeah, so to learn more about that, we're happy to share our data with you. We're happy to share our techniques with you. Just reach out to us at patienteducationgenius.com.
Very good. Well, thank you. Thanks for being my guest here, Zach, and until next time.